Today marks the 100th anniversary of the birth of Sir Richard Dall. The British scientist was instrumental in drawing a link between smoking and lung cancer. He was a smoker himself and quit when he found out just how detrimental it was. This is Dall in a 2004 interview, a year before his death.
If you enjoy life, cigarette smoking is just damn foolish because it doubles the total mortality. That's to say, it's as dangerous as all other hazards put together.
Here to tell us what we've learned about the impact of smoking is our medical contributor, Dr. Karl Kabasele. So tell us about Richard Dall and how it is that he made this link.
Well, he was a physician. He was an epidemiologist, a medical statistician, and he was called upon early in his career to look into this problem of increasing rates of lung cancer. And he worked with his partner, and they kind of explored some theories. At the time, the thinking was maybe lung cancer is because of air pollution. Maybe it's because of the tarring of roads and the fumes that come off of the roads and the tar. But they quickly found out, the evidence showed that people who smoked were the ones who were getting lung cancer, and it was very rare for someone who didn't smoke to get lung cancer. And so, you would think that that was the hard work, but the hard work was actually convincing the medical community, government, and the public at large that this was the case.
It is hard to remember or really even imagine a time at which that link wasn't made. How far have we come in understanding the health impacts of smoking?
Well, it sort of started there in the realm of lung cancer, but of course now we know everything from chronic lung diseases, emphysema, chronic bronchitis, to other types of cancer throughout the body. I mean, it's something that almost doesn't spare any part of the body. It's been linked with blindness, circulation problems, everything. So it's hard to think back to a time not that long ago when people didn't accept that smoking was bad for you.
Which leads us to this new study that came out in the journal Lancet yesterday. It had some pretty dramatic findings. What can you tell us about that?
Well, it did. And just by way of background, it's interesting because it focused on women in the UK. The peak incidence of smoking for women came after men. It was socially unacceptable at first for women to smoke, and they pretty soon did catch up. So by the 60s, they had their peak of incidence of smoking. And so it's important now because we're able to look back at that lifetime experience of all those women who smoked and figure out what was going on. So having said that, we know now that similar to men, women who smoke and continue to smoke into older age, past the age of 50, have 3 times the mortality rate. So they have 3 times the risk of dying prematurely than someone who never smoked. And maybe even more dramatic, when you take those death rates that they calculated and apply it to the population, you figure that women are giving up about 11 years of life. So it shortens their lifespan by 11 years.
It seems remarkable, and maybe you're a non-smoker your whole life. I used to smoke, that we're still actually studying this and still surprising people with the data about the simple fact that smoking's bad for you.
Absolutely. Well, today, I as a physician, work with smokers. I help them to quit. And our approach to addiction is so much different. We're not accusatory. We're not putting all of the blame on the individual, sure, because this is a powerful, profound addiction. And if you think about, someone who might be addicted to cocaine or heroin or any other drug, they're using it once, twice, maybe 3 times a day. With a smoker, oftentimes you're doing it 20, 40, 60 times a day, depending on how much you smoke. It's ingrained in almost in your very being, and it's a difficult thing to give up.
Well, thanks so much for this.
Thank you.
CBC medical contributor Dr. Karl Kabasele.